program is broken down into year 1, year 2, and year 3. Now, to break it down even further, each of the years is broken down into what we call sessions or semesters, depending on which university you study at. Each of the subjects has a number of different assessment tasks within it. And of course, we have something called a subject outline, which lists all the different learning activities that you will undertake, all the different assessments you will undertake, and of course, all the things that you need to be able to be successful in each of these subjects. So year 1, session 1. So each session is approximately 15 weeks. The first subjects you will study are Human Bioscience 1, Science Communication and Methodology, Foundations of Clinical Practice, and Paramedic Professionalism and Communication. So let me talk you through briefly what these subjects look like. Human Bioscience 1 is an interesting subject because this is all about the human body. You'll learn all about the cells and tissues and how they interrelate to each other. Science Communication and Methodology is actually one of our newer subjects, and it builds on from Human Bioscience, and it has a mixture of science and research and communication built into it. CLS 105 is your clinical skills subject. So in CLS 105, this is where you will learn about managing airways, assessing patients, applying certain items of equipment to manage fractures, how to do CPR based on the latest guidelines and evidence. Now, paramedic professionalism and communication is an interesting subject from the viewpoint that paramedics in Australia are now a regulated profession, and you need to know and understand what that actually means to be able to function safely, ethically, and morally in a modern ambulance service. Then you have a mid-semester break, and while the lecturers are marking your work and providing you with feedback, the students will be having a vacation, having a holiday before they go into session 2. And then as you can see here, you do more bioscience, remembering that as human beings we are physiological beings, and of course it's so important that as paramedics you have a good understanding of how the human body functions and how the cells and organs and tissue all work together. Now, the non-emergency clinical placement allows student paramedics to go out into the community and take part in the assessment and management and care of patients in non-acute settings. So that's typical of environments such as nursing homes, such as patient transport services, so those non-ambulance service environments. Then there's CLS 106, Foundations of Trauma Practice, and again, trauma is one of those subjects that students tend to never be able to get enough of, because they worry that when they're the paramedic, they need to be able to know how to deal with trauma. And of course, as you can see here, we have a subject on Indigenous health, which allows our student paramedics to become knowledgeable in the areas of the highly specialized field of Indigenous populations, in terms of what it means to be a paramedic, caring for that demographic, caring for people who come from an Indigenous background. And students speak highly of that subject because it's a field that they need to be familiar with, given the nature of the environments that our graduates are going to be working in. So once you've done year 1, session 1, year 1, session 2, and you've been deemed successful, you will move into year 2, session 1. They're pretty self-explanatory, these subjects. So pathophysiology and pharmacology, students will be looking at typical disease states, disease processes, and how they present to paramedics and how they will manage those presentations. And of course, pharmacology as well, given that paramedics do deliver a lot of medications in the back of an ambulance. Introduction to medical emergencies. Again, even though medical emergencies is the theme of this subject, to be quite frank, medical emergencies is actually an underlying theme in pretty much all of these subjects. In each of these subjects, there will be a discussion around certain cases that you will experience as a paramedic. Lifespan, health issues, and paramedic care. So we do have an aging population, so it's important that paramedics are well equipped to be able to assess, diagnose, and manage patients who are older adults. Health, society, and paramedic practice, again, a really important subject, given that our societal values and norms do impact on our health, including our dietary intake, our lifestyle habits. All of these things impact on the nature both of how we can perform as paramedics, but also on the nature of the cases we go to in the community. Year 2, Session 2, more pharmacology. Again, it's a pretty important subject given that paramedics give a wide range of powerful drugs that are able to cause quite some significant harm if we don't have a good understanding of how they interact with other drugs and on our patients. Integrating paramedic trauma science, again, is a mixture of paramedic trauma and the evidence behind how to manage the trauma. Clinical placement and authentic learning is an ambulance service placement, and students really do look forward to this one because it's with a state emergency service and they're able to work with qualified paramedics. So they tend to get a lot out of this particular ambulance placement. Then you can see that we've got a Year 2, Session 3. That's for the honours students only. Now, what I need to say here is that if you want to be a paramedic, that's fine, you can do it without honours, but the university will be pushing you into the honours programme because the research that you undertake as part of the honours programme will go out there and get published, and it will contribute to the growing body of knowledge that paramedicine has, and it will definitely grow your skills as a researcher. And paramedicine as a profession needs researchers to be able to prove what's right and wrong, good and bad. So it's always worthwhile even thinking about this before you even enter the programme, because you will be asked to choose relatively early on whether you want to do your honours or not. So Year 3, Session 1, Integrating Paramedical Medical Science. Now in this subject, you have a mixture of lectures, practicals and tutorials, and the case studies are now quite complex. You'll be looking at complex cases, you'll be looking at things like triaging and referral to other services and critical decision making. Advanced cardiology and paramedic practice gives our students a really good understanding of some of the more complex ECG recordings and how to manage those situations in the back of an ambulance. Emergency care in mental health is one of our newest subjects. The literature does paint a picture that there's a need for mental health training and education. The dynamics of healthcare practice, again, feeds into this idea of where do paramedics fit into the healthcare system and how they best deliver their care. Year 3, Session 2 is your final session. Paramedics law and ethics, transition to paramedic practice, clinical placement and authentic learning really are the subjects that allow you to start to think as a qualified paramedic. And then, of course, bolted into that is this idea of honours as well. So lots to look forward to, a curriculum that's delivered by highly credible, highly credentialed, experienced paramedics and paramedic academics. So again, I'm biased. I would strongly recommend people to come to CSU because they're getting a good experience here.